Hey everybody, I'm your host, Dr. Bob Lee. You're watching Open, that live interactive program that brings the Bronx and New York City straight to your TV set. You can stay connected to us through social media at BronxNet TV. Leading things off, our first guests are the director of Vitiligo and Pigmentation Institute of Southern California and her patient who lives with vitiligo. Now, they joined the program to shed some light on the autoimmune skin condition that affects more than 1.5 million people in the United States, and to speak about the medical resources that are available to those living with vitiligo. So please welcome to the show Pearl Grimes and Neil Goetz. Welcome.
Thank you, Dr. Bob. We're so excited to join you today.
Well, we're happy to have you here to shed some light on it. Neil, I guess Neil Goetz can kick it off. Neil, tell us how you got involved in this. When did you start studying this? When did it all happen for you?
Well, my journey, along with Dr. Grimes, who came on the journey with me, started about 3 years ago. I started to notice white patches under my lips and around the sides of my nose, and eventually to my forehead, just losing their pigmentation and becoming white. And I didn't know what it was. I was frightened. I was down. And I went to the doctor, couldn't really get a diagnosis. Mm-hmm. Several physicians later, I was directed to Dr. Grimes, who was an expert in the field. And she took my hand and said, you have vitiligo, but I can work with you. I can come up with a management plan and you will get better.
Neil, did you know what it was before it was diagnosed?
Well, I didn't know what it was, but then I thought I knew what it was through my reading and through a physician saying it could be vitiligo, but this office is not really the expert on this subject. You should go see Dr. Grimes.
Yeah. Dr. Grimes, the condition known as vitiligo, what are the health factors that contribute to having vitiligo?
Vitiligo, Dr. Bob, is a classic autoimmune condition where your immune system is responsible for destroying the cells in the skin that produce pigment, the melanocytes. And so when the melanocytes are lost, you get a white patch. And this white patch is a source of major trauma, emotional devastation for patients, given the contrast of the white patch with normal skin. The other issue is, genetics can be involved in that. 30 to 40% of patients will have someone else in the family with vitiligo. And we also know that when you get vitiligo, there's a greater likelihood that you can get other autoimmune conditions. The most common associated autoimmune conditions are thyroid disorders. So Yes, and the condition it's chronic and it can also be very unstable. So it's a source of major emotional trauma devastation for patients. But I will tell you, Dr. Bob, we've made so many exciting new advances in how we approach this condition.
Neil Goetz looks great. I mean, what are some of the procedures? What have you done?
We have many new topical products that we can use. We have light sources or what we call phototherapy that we can use for repigmentation as well.
Neil, how have you managed living with vitiligo, and what challenges have you faced thus far?
Well, I'm going to share something with your viewers. I'm a cancer survivor, and somehow this vitiligo diagnosis impacted me more emotionally than my cancer diagnosis, because I would look in the mirror, I couldn't see my cancer, and I knew what to do to cure myself of the cancer. Vitiligo, it was in the mirror every single day, and I'm in the entertainment industry, I'm in the public eye, sometimes I'm photographed, and I thought, what am I going to have to do? Wear makeup the rest of my life? And going to Dr. Grimes and finding out that there was help really helped my psyche.
Wow. That's deep to just be able to look in the mirror every day and say, hey, I know there's something wrong. But with the cancer, you didn't see it. But they're both
correct,
just as devastating to the person as one another. I think both affected you the same way. Yeah, I think you said one affected you even more because when you looked in the mirror, you can see it.
Yes, one affected me more emotionally in terms of self-esteem. Maybe the other affected me more in thinking of mortality. But
Yeah.
in one case with the cancer, my treatment was straightforward.
Yeah.
This disease that Dr. Grimes is going to test to isn't as straightforward. So
Dr.
it's
Grimes, you were
important to
going to
get the
say
right help.
something? I'm sorry.
Well, Dr. Bob, I was simply going to make the comment that given what Neil just shared regarding how the vitiligo was more traumatic in some ways than his cancer, and it's not uncommon to get that response from patients. For cancers or other internal conditions, it's private. They don't have to share it with the world. Whereas when it comes to vitiligo, it is so visible. So it's recognizable by their friends, their peers.
Yeah.
And so that recognition by others in a society driven by aesthetics can be very traumatic for patients.
Yeah. But doctor, sometimes you see people doing commercials now with vitiligo. Like it's okay. It shouldn't be a shameful thing.
Well, I don't think vitiligo is a shameful thing, period. However,
Yeah.
I think I'm glad you raised that point because today there's a cohort of patients who engage their vitiligo. They're not interested in treatment. And you do see those individuals in commercials. And as caregivers, clinicians, we're very respectful of those patients.
Mhm.
But my response to those individuals is straightforward. You still have an autoimmune condition where you have an increased likelihood of getting other autoimmune disorders. So
Yeah.
I think it's very important for those patients to get a physical and get their lab tests on an annual basis. But
Yeah.
I think the overwhelming majority of patients that we see are patients who are traumatized by vitiligo, who come in requesting treatment. So that, no doubt, in my experience, is the major group. And as clinicians, caregivers, I think we're more effective than ever in what we offer patients with this condition.
Now, you also have a vitiligo website series, a web series initiative. Why is it so important to share this? Say it again.
I think it's very important that we share information regarding where patients can go for resources, because we want to be able to refer patients to sites where they can find physicians who really do have an expertise in diagnosing and managing vitiligo.
Yeah.
Moreover, I think it's important for patients to find support groups. There's nothing like being able to talk and communicate with someone else who has shared a similar journey.
Yeah.
So you can find this information at vitiligo at the website. Thisisvitiligo.com. Many resources there.
Yeah. Now, does the treatment vary from person to person? Does everyone have their own individual treatment or problem with it?
Great question. There's tremendous variability in how we approach vitiligo. Every patient is unique. The progression of the disease can vary from patient to patient. Some patients may be stable for a long period. Other patients go through rapid progression. So we, as caregivers, we do not use a cookie cutter approach. We base treatment on the manifestations and what that patient is experiencing at any given time.
Well, we kicked it off about a week ago, right? Vitiligo Awareness Month. Neil, I guess you can go at this one first. How can we improve upon the awareness on this subject? How can we create the awareness in our communities about vitiligo?
Well, I think a program like this helps. Going to the website helps. Don't hide. Get out of the closet. If you have it, you can talk about it to your friends. You can help other people, which I like to do. If I see somebody that I think has vitiligo, I'll kind of whisper in their ear, I think you have what I have, and I can refer you to my doctor. So I think it's good just get it out of the closet. And the more people know, the better they're going to feel. As Dr. Grimes says, it's not in your head. It's not vanity. It's not cosmetic. It's a real thing.
Well, you look good, Neil.
Thank you.
You feel better about
Dr.
yourself,
Grimes.
more confidence and everything?
I feel so much better. Just the fact that there was someone out there that would understand that there was a management plan made me feel better. And I feel great 3 years later.
Dr. Pearl E. Grimes, MD, Director, Vitiligo and Pigmentation, Institute of Southern California, and Neil Goetz. Thank you guys so much for joining us, and thank you for sharing that wonderful information.
Thank you, Dr. Bob.
You have a website we can go to experience some more information?
You know, well, as I said, there are many resources on thisisvitiligo.com. It lists other websites where patients can get enormous information regarding vitiligo.
Well, thank you guys so much, and join us again, okay? Share more. We're here for you.
Thank you so much.
Okay. We'll take a quick break. I've got more open coming up next.